like to start by reading a poem that was written by a friend of mine, Diane Evans. She's the one who was responsible for the Women's Memorial out in Washington, D.C. And it's, I don't go off to war, so they say, I'm a woman. Who then has worn my boots? And whose memories are these of youth suffering, of blood and burns, and of their tears and their cries? I'm a woman, and I've tasted men's war, our war, and he knows that I love him in no greater way than to share in his life or his death. What are the rules? Man or woman, we are a prey to suffer and survive together. Please don't forget me. I've been through war's hell, and if only you will listen, I have a story of those chosen to sacrifice for us all. So, on to my story. I suppose you're wondering how I got into all this. I was in my senior year of nursing school, and it was on a weekend, and I was sitting in our lounge with a couple other nurses and one of the nursing students, and one of the students came in, and she was all excited. She had just talked to a recruiter, and she was telling us about these wonderful opportunities in the Army. So we all went down and we talked to him, and he told us about great opportunities and the things we could see and the places we could go. And one of the places he kept saying was, he said, you know, there's a beautiful place, Fort Ord. It's right on the beach in California. Wonderful place, and I bet I could get you there. And so then he said that they were going on maneuvers the next weekend down in Florida, and asked if we wanted to go. Well, here's 4 women, and there's a whole plane load of guys, and we're going on, gee, that's not a hard one. So we said, sure, we'll go. And of course, they wined us and dined us, and he again was telling us about Fort Ord, this wonderful place right on the beach in California. So right after that, 3 of the girls joined. I still had reservations. I had friends who had come back from Vietnam, and they said, whatever you do, don't go to Vietnam. And so I talked to him about that, and he said, if you're a female, they cannot send you unless you volunteer. If you volunteer, we'll have you there in a week. But unless you volunteer, they cannot send you. So I thought about it some more, and I finally signed on the dotted line. So, we were so surprised. You know, we got Fort Ord. We were so happy. It's right on the beach, and I was there a month, and I got my orders for Vietnam. So I took it to my commander and explained the mistake. And she just grinned and looked at me and said, and do you have that in writing, Lieutenant? Nope. So, pretty soon, the other 3 girls got their orders, and in June, we were all on our way to sunny Vietnam, except the girl who talked us into joining. She went AWOL, got pregnant, and was out of the service. So, preparations, they have like a mock village there that you go through, and so we had to go through that. We learned VC tactics and different things what to bring along, physical and dental workups, and all those inoculations, both arms, up and down, up and down. In our training for Vietnam, there's a weapons course. They let us hold a gun. They said women aren't allowed to fire a weapon. Remember, this is 69. So we got to hold it and look at it. Well, that's nice. And that was our training for Vietnam. So then I got sent home on leave, and I was there for a month, and spent time with family and friends, and got things ready. Some other gals who had just gotten back and were stationed at Fort Ord had mentioned that bring lacy, pretty underwear, stuff like that, so you don't forget that you're a female. Oh, and by the way, Fort Ord, we found out, was the staging area for nurses to go to Vietnam. They failed to mention that when they were pushing it. So the other thing that I did, I ate lots of steak. lots of ice cream because I knew I would not be getting that over there. We went on a commercial airline, and even though they had all the niceties for us, there was dead silence. There was not a sound. Everyone was thinking their own thoughts, and I think people prayed even if it was for the first time in their life. When we got off the plane, the first thing that I noticed coming down the gangplank there was the intense heat. The second thing was the smell. That is something that stayed with you for the whole year. As we were coming down, I heard this pop, 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 and people started shouting, and they were pushing us down the steps and telling us to run over to a building. We were under small arms attack. So that was my introduction, the very first thing that happened in Vietnam for me. Since it was late in the day, they sent us over to stay at the train with the nurses over there. And the big talk of the day was the nurse who had just gotten killed the day before. So that was a little bit more introduction. And then you see all the wire, concertina wire all around, and you hear rockets and mortars all around. So the next day, we left for, I was stationed in Pleiku, Central Highlands, 71st Evacuation Hospital. And so I went up, and there were two choppers that left. There was one ahead of me and then our chopper. And the chopper ahead of me got shot down. So when we got there, again, it was late in the evening, so it was too late to go and find out where I was going to be sent, to work. So I was shown to my hooch, and a couple of my hooch mates came out, and we had a little step outside the hooch. It was a wooden structure. I think there's some pictures of it over there. It was a wooden structure, and there's a little step, and we were out there sitting, and I heard a whistle and a thud. And the next thing I know, I'm looking around, and nobody's there. It's like, where'd everybody go? And then I heard some more whistles and some more thuds, and pretty soon one of the gals came out, grabbed me by my collar, and she's shoving me in. She said, just get under your bed, just get under your bed, we're under rocket attack. So 31 rockets hit us. Luckily, our compound and around the compound, luckily there were no casualties. So again, another introduction. Then they took me for a little tour, and I had forgotten a lot of things, so I just need to read this. Let's see. There was the ER, the OR, post-op. There were surgical wards, central supply, lab, and all these things. There were long walkways in between each building. There were wooden and long walkways. There was what they had, a morgue. But usually it was very small, and there were usually more casualties. So those were lined up outside of the ER. The beds were just piled up until a truck would come to take the bodies away. There was a dental wing, an eye clinic, the mess hall, and then the EM quarters. There was a clubhouse, and a laundry was behind there. And then there was a Red Cross area. Different clinics, a pharmacy, chapel. There was a PX, a clubhouse, and then the nurses' hooches. And then all around us, spaced equally, were guard towers. The next morning, I went to headquarters to find out where I would be placed. And I expected that to be Postdoc because that's what my MOS, which is your military occupational specialty, was. So I expected that that's where I would be placed because I had a whole 3 months training in that area. When I got there, they told me that they needed someone in OR. And I just totally freaked out. I had had a very bad experience in nursing school in OR, and it's like, no, cannot send me there. Well, I was the next body through the door, so I went to OR. They had a lot of cases going on, and so they said, they had me put on a mask and gown, so just go stand over there and watch a case, because we'll start you out circulating, which means like you run for supplies, that type of thing, and then eventually you'll start scrubbing, which is handing instruments to the doctors. So I was sitting there watching, and it was a really bad case. The young GI had already lost both legs. He had head trauma, he had abdominal wounds. There were a couple doctors working on him. This right arm was kind of hanging there by a tendon, and a doctor looked up and he said, "What are you standing there for? Don't just stand there, do something." And he threw the scissors at me and said, "Cut his arm off." So that was my first 5 minutes in OR. So I think my first 48 hours in Vietnam is where my post-traumatic stress came from. And then just continued to get worse from there. The attacks, we had rocket and mortar attacks almost every day. And you know, you hear that toward the end. Sometimes your last couple of days, that's when you get killed, you know. So on the day I left that morning, we had 3 attacks, and I was sure that was it. But I did make it out. And I really didn't think I was going to survive. And so I did send to a friend of mine. I made out a little will and sent it to her. You know, I didn't want my parents to know that that's how I felt. So I sent the will to my friend. And some of the attacks probably occurred because we had an ARVN unit by us. That's Vietnamese soldiers. And we had an Air Force base on another side, and we had a Mars unit on a third side. So I'm sure a lot of those rockets and mortars were aimed for them and not us, but they weren't always very accurate. And as I said before, the males all had bunkers to go to. The women did not. Not only that, but our hooches were on top of a hill, and on top of our hooches were a big red cross. So it's like, here we are. Go figure. So the sound of a chopper brought everyone running to the helipad. You hoped that it was just a helicopter that might have 1, 2, 3 patients in it. You did not want it to be a Chinook, which we called shithooks. It was a huge airplane that, a cargo-like plane that carried up to 100 patients at a time. If one of those landed, you might have been on your way home, you know, back to your hooch after a 12-hour shift. But if one of those landed, you turned right around and you went back, and then you'd be there for 3-4 days nonstop. The OR that I worked in consisted of one large room. Anyone see MASH? You familiar with MASH? It was a lot like that. It was one big room, and then we had partitions that could be moved, you know, however you needed them to make more space or less space. And that's what it was like in there. We got all kinds of cases in, and everything from newborns to the elderly, and we had burns, we had amputations, we had anything and everything in between. Sometimes they got so bad that in order to save our sanity, we had to make up names for them, which we did, and it may seem disrespectful, but we had to do that in order to say it. Oh, here comes another horrendoplasty, or oh, here comes another crispy critter. You know, you had to do that in order to save your sanity. Many cases, there was a shortage of doctors, so many of the cases, such as the easier ones like the debridements, where you just maybe had maybe they were superficial wounds and you just had to take the skin off, the dead skin off, were done by the nurses and the corpsmen. And actually we had some corpsmen who were actually doing vascular cases when we were really short and the doctors were needed for more really most of your cases. A lot of times we were on our hands and knees during rocket attacks with a flashlight doing cases. And we often ran out of supplies, of sterile linens, and blood, and isopro, which would be very important to a GI who was severely wounded, because they were being sold on the black market. All you had to do was go down to Pleiku City, and you could find all of our supplies for a price. So after a while, there was one stretch of time where we really had no supplies, and so we started cutting up our bed sheets. We started doing anything that we could to continue working. The normal working day was 12 hours on and 12 hours off, as I said, but like I said, if a Chinook came, you were there for the duration. After maybe 24 hours, they might give you 2 hours to sleep. They would bring a mess cart down, and if you could, in between a case, you'd grab something. Sterile technique, well, okay, sometimes, if you had time, you scrub for 10 minutes. Other times, you just put your hands through the water and went on to the next case. On the brighter side, there were things that we did, like for the 4th of July, although we got casualties in, so it actually became the 6th of July. We had our first annual Olympic Day, so we made up all these games and things. If it were someone's birthday, we would borrow supplies from the mess hall. But remember, this is for large amounts of people, so your cake mix was like 5 pounds, and they made this huge cake. So you never know kind of what you were going to get. Dating, there was the Air Force Base there was Special Forces and stuff, so dating. There was one time that I will never forget, a Special Forces guy had asked me if I'd go out with him for a Jeep ride that night. I said, well, only if my friend can come with me. So he said, okay. So it had just rained, and we were going through puddles, and I had a bright orange dress on. Now, this was at night. I got a bright orange dress. The mud is splashing up over us. We're laughing. That next morning, I'm thinking, what were you thinking? We were out there. There's landmines everywhere. There's NVA everywhere. We're out there laughing in my orange dress. Oh my gosh. So we had a swimming pool, which you might think, wow. However, you had to have one of the corpsmen be a lifeguard. Well, the corpsmen did the 12-hour shifts just like we did, but they also pulled guard duty. So when they weren't doing that, then they could be at the pool being a lifeguard. So even though we had a pool, you didn't get there too often. But when we did it, it was nice. We had mama sans. There's some pictures over there also. Some mama sans who were Vietnamese people that we paid to do certain tasks, like wash your clothes. You never put anything good in because they put them in a basin and with their feet. That's how they washed them. And so nothing good. And we bought them an ironing board, but that sat there. They were down on their hands and knees with the iron. They would never use the ironing board. Even though you had locks on your room, your jewelry would disappear, money would disappear, things would disappear. In fact, after a while, I was really glad I didn't work in the ER because those nurses started to have to do vaginal checks, because so many things were disappearing from the compound. And you would not believe what you can get in one of those. I had asked for R&R in Australia, and I had also asked for Hong Kong. Well, I got the Philippines and I got Thailand. Very much like Vietnam. And I was so excited when I got there thinking I could finally get some ice cream. Well, they had ice cream, but it sure didn't taste like ice cream to me. Many effects still remain with me for quite some time, and still exist today. Some of them were comical. Like the first time when I got home, my mom asked me to go to the grocery store with her because she wanted to know what I wanted, just get whatever you want. So we're walking down the aisle, and a woman behind me dropped a can. The next thing I know, I'm down on the floor like this. My mom's sitting there in shock. Everyone's looking at me who's in the aisle. I was so embarrassed. I never went grocery shopping with my mom again for a long, long time. Other things are not so comical, like some of the nightmares that I had for years and years and years. I've done a lot of counseling. There were 3 major nightmares that I always had. Those, thank goodness, are gone for the most part. I can hear a chopper probably 5 minutes before anyone can hear one or see one. And I have mixed emotions when I see Vietnamese people. My parents had never had a vacation, and it was their anniversary around the time that I was going to be going home. So I sent my friend money and had her buy tickets and for Hawaii, and then I asked for a delay en route, and I was able to stop over in Hawaii and spend some time. And I had told my dad not to bring any money. I was paying for it all, and I was going to get this fancy hotel, and we were going to be wined and dined, and we were going to do all the activities. We were going to do all the island hopping. But 2 days before I left, when you get there, you get what they call funny money, MPCs. And when you leave, you have to be turned back into your American money. So I did, and I kept the money, because it's money I saved all year, in my pockets of my uniform. I slept in my uniform, and then I wore it to work. So I still had to go back to work until even the morning that the day I left. And the day before I left, I was changing my uniform and putting on a different uniform, and the girl at the end of the hooch screamed. So I ran down to see what the problem was. And while I was talking to her, our mama-san went running out the door. I knew immediately. So I went down and checked. Sure enough, all my money was gone. So we chased after her, and we're hollering at the MPs, stop, 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 stop her. And they're going, what? So she got away. She's one very rich mama-san. So unfortunately, we ended up kind of in a sleazy hotel. I was able to borrow a little bit of money from a couple of friends. But we didn't get to do the island hopping and things. But of course, my parents were so happy to see me that they didn't care. I tried to give you a general feeling of what my year in Vietnam was like, but I find that it's impossible to convey many of the memories, especially the bad ones, and to express many of the emotions and feelings that I experienced. But I remember the long hours and the endless stream of gravely wounded casualties. I remember working on our knees in surgery during rocket attacks, or rolling under my bunk when they went off because the women didn't have bunkers to go to. I remember the feeling of terror when I discovered the body of a dead NVA soldier just feet from our hooch, following attack, knowing that my room was the first one through the door. I remember the look on a young soldier's face when he clutched at my arm begging, please don't let me die. I remember the despair and anger when we went up without medications and supplies because they were being sold on the black market. I remember the never-ending feeling of isolation and loneliness. I remember the feeling of utter hopelessness and futility that I felt after learning that one of our nurses was reduced to a vegetable and fighting for her life after arresting from an overdose of Darvan compounds during a fit of desperation with less than 1 month to go in country. And I will never forget looking down at the take of a body bag and seeing it was a young chopper pilot I had just joked with the night before. And I will never, ever forget crying all the way to the morgue every time I had to take a body up, crying not for the young man inside, for it was too late for him, but crying for the family left behind, who would be without him forever. The last thing I want to impart is never forget the high price of freedom, a price every veteran and their family has paid. There are lifetime consequences of war, the types of wounds on the Iraqi and Afghanistan vets coming home, they will have all of their lives. Statistics show that 1 in 3 will return with severe PTSD. I don't think that there's anything important enough to go to war. America will not be great for the amount of wars it has fought, but it will be great when it learns how to establish peace and teaches that to other nations. Thank you. Any questions?
Lynn, did you have any exposure to Agent Orange, and what were the ramifications of that?
After doing some research, I found out that our compound, Agent Orange, actually, there were actually 5 different agents. There was an Agent Orange, an Agent White, Pink, Blue, and I never can remember the 5th one. But there were 5, and so it depends on where you were. But I found out ours on our compound was either the white or the blue. And they sprayed more of that on our compound the year I was there than all of Vietnam for that whole year. And you know, they say the best thing for your child is to breastfeed them. So, you know, wanting to be a good mother, I breastfed my girls. Well, Agent Orange is stored in fatty tissue, you know, and what's fattier than the breast. So, unfortunately, I have passed a lot of that on to my children. They have a lot of physical things. I've been fighting with Agent Orange. I have a lot of things going on. So, yeah, it's been a big factor. And it's the gift that keeps on going. My grandchildren, some of my grandchildren now have some things. Anybody else? Yes.
Did you always stay at Pleiku, or did you get to a different hospital? I was up in Flubai. That was a big hospital up there.
I was always in Pleiku, although, you know, Central Highlands is where the mountain yards are, and those are they're the original people of Vietnam, just like our Native American Indians are native here, are the original peoples here. They were the original peoples in Vietnam. And a couple of times I did go there to do some nursing care, but it got too dangerous. And I forgot to wear my bracelets. Anyone who's been to one of the villages know that you can earn bracelets depending on how much rice wine you drink. Well, I don't remember drinking the wine, and I don't know how much I had, but I remember coming back to the compound with 3 bracelets, which I have at home. What was your question? The rest of your question? Oh, did I get off? The only other time I got off was Linda Vanter, who wrote Home Before Morning. That's the book over there. We got in trouble, and she was banished to Queen Yan. Well, we went to visit her once when we had a little extra time. Well, Queen Yan is on the beach. It's wonderful. We came back trying to think of what we could do to be banished. But and other than that, R&R, and that's all. Otherwise, I was always at Pleiku. Anybody else? Yes?
MASH is obviously a popular show. When you watch MASH, what do you think of that show?
I love it, and they do stuff on there that I wish we could have gotten away with. But as far as, you know, like I said, you know, it's very realistic as far as like how our setup was in surgery and everything. Pretty realistic. Except, like I said, they got away with a lot of things that we couldn't. Another thing that I want to mention. Our commander was, by the books. Old World War II man. Nothing against anyone who was here, World War II. I love you, but he was just, he was going to do it this way, and that was going to be it. And our enlisted men already were working 12-hour shifts. And the 4th Division had volunteered to send guards to do guard duty for us. And he says, oh no, we can take care of it ourselves. So in addition to their working, they had to also pull guard duty, which ended up causing a big drug problem because when they got off work, if they could, they'd catch a couple hours sleep. So they'd take a couple of downers quick so they'd be able to sleep. Then they'd have to take a couple uppers so they could stay awake. And then pretty soon it was more and more and more. And so it developed into quite a bad drug habit over there. And it was all his, because of him. And he did such dumb things like, we're in the middle of a war, but, you had to have your boots shined and you had to have, just, who cares? You're trying to save lives. You don't care if your boots are shined. So that was another thing. Yes?
I came in a little late. I don't know if you addressed this in the beginning. Were you in surgery every day? Were there constant casualties coming in every day, or did it go in waves, or?
I think we had one day off. Oh, I think you got one day off. But if a Chinook came, all bets are off. No matter where you are, you're back.
But other than that, there were choppers every day bringing
Yeah.
wounded or.
Yeah. We had the 4th Division, but we also got a lot of the Marines. We got casualties in that were marked classified. Of course, they were coming from Cambodia, but they said we weren't in Cambodia, so then they were classified. Then they said we were in Cambodia, then they came marked Cambodia, then we weren't there again, so then they came classified again. So, we got them from all over. And we also treated the Montagnards. We also treated a lot of the Vietnamese and the Arvins, because they were in our area. So, like I said, from baby on up. In fact, that's another story. I was asked to, this woman came in who was the wife of an Arvin general. And so they offered her the courtesy, she was pregnant, of delivering in our hospital. So they asked me just to watch her. And they said she's in early stages of labor. She just not a sound, just laying there stoically. So I said, well, okay. About 5 minutes later, I hear this little, And I thought, maybe I ought to check her. So I did, and here's the baby's head. They're very stoic. They don't make a sound, And then when after they have the children, they usually just, within a few hours, they're usually out working in the fields again. And the Vietnamese also might smoke joints over there. Their marijuana is very different from our marijuana here, very strong. But even it's not uncommon to see a young child smoking marijuana, and it's not uncommon for a mom who has just nursed her baby to put one in her baby's mouth while she goes back to work. Yeah. Anybody else? Yes?
Did you continue with your nursing career after you came back and started pulling your life together again?
That's a very good question. When I came back, would you believe the only positions that were open were in surgery for the longest time. And that was very hard because we had surgeons over there doing huge cases with a basic instrument kit. Back here, you'd run into these prima donna surgeons who, I remember one case, I was so upset because he stopped in the middle of a case because someone had forgotten to cleanse one of his instruments that was his own special instrument. And so it wasn't available to him. He stopped the case. You don't have a patient laying there because it took 30 minutes to autoclave. You don't have him laying there under anesthesia for that long, just for that reason. And he just sat there like a 2-year-old and throwing a tantrum, and he would not continue with surgery until he had his instrument. And I'm just so thinking, send the sucker to Vietnam. And then the other thing, when I first got there, you have to go through an introduction at each hospital. Well, they told me I had to go, I had to learn how to start IVs. I'm down on my hands and knees with a flashlight during rocket attacks starting IVs, and I have to learn how to start an IV. But they said I had to. They would not hire me until I went through all the stuff. And so I did, but I knew more than the person telling me what to do. And just those kind of things, just very hard to come back to the United States and reorient. Anybody else?
How long did it take for you to feel like you were getting back to normal, whatever that was back here?
Well, it's been 44 years and I'm still waiting.
Okay.
The emotional thing is, to try to get where you can feel again, because you had to shut it off for so long, that type of thing. The rages, they're not as bad as they used to be. There's no more spaghetti up on the ceiling. The kids don't run and hide anymore. Of course, they're gone, but. Anything else? Yes.
Did you have to go through, my daughter-in-law's a doctor, and she has to go to different hospitals and be interviewed? Is that what you had to do when you came back home? Go from place to place to be interviewed, to be a nurse?
No, you just go to wherever you want to go, and you go to personnel and you're asked if they have any openings anywhere. Yeah. Anybody else? Yes?
How long after you got back were you able to go to a backyard barbecue without feeling sick?
Well, I tell you, before I went, I worked in a meat department. It took me a long, long time just for after working in a meat department before I could eat hamburger again. After seeing what they do. I don't think that bothered me as much as some of the things like choppers and that kind of thing.
I was wondering, had to pick up the crispy critters to load them up, and it took me about a year and a half before I could attend a backyard barbecue, because the smell would bring back the memories right away.
Right. Welcome home. Anybody else?
I have one more. How are we received over there by the people you dealt with, the local people? Obviously they stole your stuff at the end or whatever, but all in all, did you get the feeling that they treated us like invaders, or that they were appreciative that we were there, or?
The mama sons that we hired were caught one night out in the field setting up rockets aimed at our compound. Did that answer your question? Yeah. Anybody else? Yes.
What kind of treatment are you getting now for your PSD? With VA?
2 years ago, I asked my VA provider if there was a female counselor. She said they didn't have one. I went to Camp American Legion in June, and one of the presenters there was a female counselor from the Vet Center, which I didn't realize we had here. The Vet Center is different from the VA, although they're sort of under the same thing. And she's been here just a little over 2 years, but she's leaving in July. So, why didn't my provider know about her? So, it's been a couple of, I'm looking for somebody, haven't found anybody yet. I've tried some of the people at the Wausau one, but it didn't work out real well. The one person that was really good, Ian was his name, he was awesome. He had asked for more help as the Iraqi and Afghanistan vets were coming back because he was overwhelmed. They told him no, but when he left, they replaced him with 3 people. So, yeah.
When you got your medical papers, did they black out a lot of it? On my cousins, they blacked out a lot of his writing. They just went through it and blacked everything out about Vietnam, where he was sent, and how he was sent back.
No, they just lost my papers.
That way they didn't have to black it all out.
That's right. Yeah. And like I came back with jungle rot. You know, we have monsoon for 3 months over there, monsoon season. You're in those boots, and by the time you get from your hooch over to where you're working, you're soaked. So I came back and I had some jungle rot in one toenail. So I went to the VA down in Milwaukee and they said, oh, you don't have jungle rot. You must have gotten whatever you've gotten walking barefoot in a park. Well, I've never walked barefoot in a park. But they gave me the same medication that they give for the GIs who have jungle rot. Yeah. Oh, and something else that there's very little in Wisconsin for female beds. I mean, they're getting better, but very little, especially when I was back. And in 1982, when I started to swear at my kids, I knew I needed to do something, and so I applied to Toma to go through the PTSD unit. I didn't hear from them for a while, and afterwards I became friends with some of the nurses, and they told me that I created quite a stir. They didn't know why I would want to come there. What was my agenda? Was I a woman's liver? And so if they said no, would I cause all kinds of problems? So they didn't know if they should say yes or no. Well, they finally decided they better say yes, so they admitted me. Well, the guys sleep in one big room, and they couldn't put me in with them. So there's only one female ward there because you know, there were so few females at the time. So everything was on there. So because of that, because you had everything, psych cases, everything, it was a locked ward. So I was locked in. And that night, there were 2 beds in there, mine, and then during the night they sent a gal in who had overdosed. No one came in all night to check her, so I'm sitting there like this all night long, watching her chest go up and down to make sure she's still breathing. So I told the fellas in the morning, and they got really angry, and they said, hey, she's going to be over here. You know, she's not going to be in a locked ward. So what they finally did is they cleaned out the closet that was next to the men's ward, and they put me in the closet. Well, then there was the issue of showers. Where do I shower? They didn't want me showering where the guys shower. So the guy said, well, she can go down by the drug and alcohol center and we'll stand guard. Well, they said, well, no, that's not going to work. So finally, one of the nurses would walk me down to where they have showers, and she would stand there and wait. And of course, after a while, they got to know me, and then they just gave me the key, and I'd go down. When I got out of the program, the same program I went through with the fellas, they automatically got 30% disability. They gave me 10. Then they said, okay, after a couple months, reapply. So they did, I did too, and they got 50%. Well, now I got 30. So it's always been a struggle. It's being female. Anybody else?
There's, been a lot in the news about the sort of fractured healthcare for vets. And have you experienced any of that personally?
Yes, I have. Representative Kind has had that article in the newspaper how everything's fine in Wisconsin with the VA. Well, I called his office and I told him I'd like to discuss that article with him. He's never called back. I have been on a waiting list to be scheduled because they're so far behind in dermatology. I had skin cancer, and I'm supposed to be going back for regular checkups. But they put me on a waiting list to even be scheduled. Well, I finally, now after months and months, and when all this broke, all of a sudden they called me, and now they got me on the schedule, and I went Friday. So yeah. It's here in Wisconsin too.
How were things going?
Pardon?
You said you were finally scheduled, and you were finally on there. How's it going for you?
far as,
went Friday.
I went Friday. Yeah, I finally got in. Anybody else? Well, thank you very much.
Thank you.